Jeff. Good to see you again.
Hi, it's good to see you too, Carrie.
So since we met last week, you were able to see the psychiatrist, Dr. Andrews, and I understand that he diagnosed you with anxiety.
He did.
So what I'm going to do is clarify my role. So I'm a licensed clinical social worker, and Dr. Andrews is the prescribing doctor. So I'm not allowed to prescribe medications, but I can help you monitor your progress and the symptom reduction, any possible side effects. But then I also will be able to provide you with some therapy techniques that will help reduce your symptoms as well. So medication combined with therapy tends to have the best outcome. So something else that's really important is to have your primary care doctor involved in these conversations. So what we would prefer is that you make an appointment to see your doctor and let your doctor know the new medication that you'll be taking. How does that sound?
All right, yeah, that sounds good.
Okay, good. So you said at your assessment last week that sometimes you feel disorganized and you forget appointments a lot. You also said that you worry about things a lot of the time and that this has been going on for quite a while, for a few years. You also mentioned frequent stomach aches and that you take Tums a lot. Is this true?
Yeah, it is. My wife gets frustrated when I forget appointments and then I have to change everything at the last minute, and I feel like she's nagging me all the time, so that doesn't go well. I am a little unorganized, and I think that does lead to my irritability, but it would be great to get some help with this. I do want to do better and change. So.
Okay, great. So one way that we'll be working together is using a technique called cognitive behavioral therapy. And I have this chart right here that shows a little bit about it. So your cognitions or your thoughts lead to feelings or emotions, and that drives behaviors.
Nice.
So we'll be working on this.
Okay,
we'll
cool.
also be working on some mindfulness techniques to help reduce your anxiety and reduce your symptoms. How does that sound?
Well, that'll be nice. I look forward to that too.
Good. So the medication that you've been prescribed is an antidepressant called Paxil. And even though your diagnosis is anxiety, the antidepressants show to be really helpful. And the way that the medication works is it allows your receptors to receive more serotonin, which will help regulate your mood, as well as your attention, your behavior, and even your digestive process.
Huh, interesting.
Have you started taking your medication yet?
Well, honestly, no, I have not. I still have some misgivings about it, but...
Okay, well, what are your concerns?
I just don't want to feel like I need a psychiatric or whatever, something manipulating my mind due to my drug addiction and all that. I just have reservations.
I hear your concerns, and you were very candid with me in your assessment last week, talking about your long-term past drug use. And I really commend you for working so hard on your sobriety. 13 years is a really long time, and I think that's really amazing.
Thanks. I appreciate it.
But sometimes when we use drugs for a long time, then it changes our brain chemistry. And so what this medication is going to do is to help regulate your mood. And actually, anxiety impacts 18% of Americans. And so almost 1 in 5 people have anxiety. So on a scale of 0 to 10, 0 being not at all and 10 being the worst, how would you rate that your symptoms affect your life on a daily basis?
I don't know. Probably somewhere around a 6. Sometimes only a 2 or 3, but sometimes an 8. So it just varies.
What would it look if that number was a 1 or a 2 or a 3?
Well, I'm sure my wife and my friends and my coworkers would appreciate that. Sometimes they get frustrated with me, so I'd like to change that.
Good. Well, I'm glad that you're on board. So the medication does take about 3 to 4 weeks to start showing effects. And so what I'm wondering is, would you be willing to commit to taking it for 4 weeks to see if it makes any change?
But yeah, I can give it a try. Everything's, you can try it. And if I hate it, then I can stop it. I just really haven't been prepared to do that. But I suppose we can give it a try.
Okay, great. I really appreciate your commitment to taking this step. One thing that's really important is that you consistently take the medication every day and at the same time each day. What we'll do is you and I will continue to meet weekly, and we'll monitor your progress. We'll monitor if there are any side effects. The one thing that I really want you to watch for is feelings of self-harm. So if you're starting to feel suicidal thoughts, then that's something that's really important that you talk to me and to your psychiatrist and your primary care doctor about.
And see, these are my concerns because I don't feel that way now. And I don't really think that there's a problem with me a lot of the time, but other people do, so that's why I'm willing to give it a try. But you saying that is the exact reason why I haven't started.
Well, and what I want you to understand that this is only a possibility. So it's not every person who takes the antidepressant has this, but it's just something we want to watch for. Okay. So who are your support people that you could talk to if you did have these feelings besides me and Dr. Andrews?
Well, I have my wife, of course, but outside of that, I have my sponsor of 13 years, and I have about 5 guys, really 2 or 3 that are really solid, but I have guys that I talk to about this that I got sober with, so I have a really good support team, and I'm grateful for that.
Yeah, it sounds like you have a lot of support, and that's going to be really helpful during this process.
It will.
Do you have any further questions?
No, I don't think so for today. We'll just give it a try and see how this goes.
Okay, great. Well, we'll meet next week, and we'll start working on the cognitive behavioral therapy.
All right.
And we'll check in on your symptoms and see how it goes.
All right, great. Could I maybe get a copy of that too before we leave?
Absolutely.
All right, sweet. Thank you. All right, bye-bye.